I've had my second week of treatment in London for the FND rehabilitation programme. My first session on Thursday was CBT, Cognitive Behavioural Therapy, where we talked about my earlier experiences and established some of what my core beliefs might be, which are often quite negative, and then that can be reactivated later on in life. That might sound quite confusing, but it made a lot of sense to me as I was going through the worksheet with the therapist. Obviously, I'm not going to explain everything that we talked about because it's personal, but I think it's a good start for me. Then we had a bit of a gap, some time to fill, so we went to the hotel that the hospital put us up in overnight, and luckily we could check in earlier, although it wasn't an accessible room this time, unfortunately, so it was a little bit tight, but we made it work. We're in a twin room. This room is a little bit tighter. We're just about getting my chair through the door. That bit. But we made it. Hi. Then I went back for physio, which was essentially an assessment, testing me how I can do certain things, like going from sitting to stand, if I can stand with my eyes shut for 10 seconds, stand on one leg, all sorts of stuff. So it was quite tiring. When I was learning how to go from sitting to standing, I was quite surprised at how much I had started to rely on my arms and would literally just use them to push myself up off the chair, which would then cause obviously lots of tension in my arms and my shoulders and would possibly make my neck hurt. We practiced that a lot, and then that was my homework for that night, to practice that throughout the evening, and I've found that I can already stand with a bit more confidence. I'm not so shaky when I first stand up, so that's also a good start. I did have videos of me taken during the physio, but I'm not sure if I can actually show them to you, if I'm okay to use them. I will ask next week, just because it might be quite useful for other people to see. They also took a video of me walking down the corridor. They take one at the beginning and then they take one at the end to see the difference. So I was kind of using the wall quite a bit and leaning on it, and I didn't get all the way to the chair, but I was kind of, my hip tends to fall to the side and all of that was kind of happening, so they just put the chair behind me, but I got further than I thought I would. Then Friday morning I started with physio, where I was shown my exercises to work on throughout this week. There's lots of exercises where I'm trying to keep my knee steady. I found that it snaps back quite a lot and it just doesn't kind of want to stay in place. So what they did at physio, they put an exercise ball in front of my legs so I could stand holding on to the bench in front of me, but try and keeping my knee on the exercise ball. But obviously it was sort of going backwards and forwards, so that's my homework basically for this week, to try and get my knee a bit steadier using those exercises. Before I had physio, I had a seizure in the waiting room, which didn't stop me from obviously doing my physio. I carried on all right, and then during CBT we spoke about why I might have had the seizure and worked through a worksheet, which is like the situation. You write down the situation and then your thoughts and feelings. I'm looking at the worksheet to try and remember. And then your behaviours. So that's another worksheet that I've kind of got to come home with as homework, to work through that in, if I find different situations that set off my symptoms, or when I feel a symptom coming on, I can write it down and then write the alternative thoughts and feelings and behaviours around the edge. So I'll see how I'll get on with that. We also spoke about an applied tension technique to try and stop the seizures from happening, or to help prevent them. I'm going to read the worksheet because I can't remember it all. So it says, with arms outstretched, make tight fists and hold for 10 to 15 seconds. You should start to notice a warm feeling in your head. Slowly lower and relax your arms once you notice this feeling. Repeat 3 to 4 times at 20 to 30 second intervals. So I'm practicing this a couple of times a day, see how I get on. At the moment, it's not been great. I've had about 15 seizures since we got back on Friday, but I do think that was because I was just so tired. And I've got a seizure record to fill out now for next week. Then in the afternoon I had occupational therapy, where we spoke about what I do on my good days, literally throughout the whole day from when I wake up to when I go to sleep, and then what I do on my bad days, so just comparing them. Then we talked about my goals and how close I am to achieving them, which obviously at the moment isn't very close, but I guess that's the whole point. So that's about everything really. So I've got lots of worksheets to fill out, my physio exercises to do, work on like breathing techniques, and use the mindfulness app to do like body scans and well, anything else I might find useful on there. I downloaded Insight Timer, which I find quite useful. They did recommend Headspace and Calm, which I have used before, but I found those a bit more limiting, whereas Insight Timer seems to have a lot more options on there. If you follow me on social media platforms, then you obviously know the transport home was a little bit of a nightmare. I'm not going to talk about that too much because I just want to focus on the positives of treatment, which there were a lot of over those couple of days. And again, I look forward to week 3, and I'll tell you all about it once it's done. Thank you for watching.